And I'll try to watch the chat box for comments or questions or whatever. Let me hide it though because it gets in the way of the PowerPoint. Okay, like I was saying before some of you come in, psychological and psychiatric disorders are very similar, and I found that a lot of them are associated to depression. So I think you'll find them interesting, which I could have made the PowerPoint 3 hours long. I just kept finding stuff. Adjustment disorder. It's known as AD, and it's sometimes called exogenous, reactive, or situational depression. It occurs when an individual is unable to adjust to or cope with a particular stress or a major life event. And that could be a death in the family. Um, it could be somebody going off to war. There's so many things that people have trouble coping with. And if you want to throw out suggestions, hi Eileen, welcome. Um, Feel free to do so. It's just, it's hard to adjust to some things in life. And people, let me state this before I go on. People used to think if you were depressed, you were crazy, and that's not so. You've got to have some sense to be depressed. Hey, Bernie. Anxiety is a mental and physiological response to a stressor. It is characterized by fear, worry, irritability, and related to situations perceived as uncontrollable or unavoidable. I don't know if any of you have experienced anxiety. I'll be honest and tell you I have. Oh gosh, let me see what Annette's saying. It looks like a horrible comment. Annette lost 3 or 4 people in 6 months a couple of years ago. Needless to say, I did not handle it well. No, I can just imagine, Annette. Well, I really can't imagine because it's never happened to me. Um, I have anxiety, and I'm not ashamed to tell it. Certain things make me anxious. It used to make me anxious to talk to a group of people, but I've got that mastered. Um, I don't know if any of you have had panic attacks. The first panic attack I had was when my grandfather died. That was the first person in my family that had died, and I had never experienced death before. And my dad took me to a doctor, and he said, "You've probably been having many panic attacks all through your life. It took something major to bring it on," which was the death of my grandparent. You all are going to think I'm crazy. Um, Jennifer says she's been having increased anxiety with menopause. And I have heard of that, Jennifer, because that's such a change in your hormones. Annalise says, yes, she's had panic attacks and it was awful. I was way too stressed and couldn't understand what people were saying. Um, Jennifer says, I struggled with it a bit before, but worse now. The first one I had was when my grandfather died, and I happened to be in the van with my parents coming from a water park, and I asked them to pull over. I didn't know what was happening. My mama recognized it right away because my dad had had them, and that was the first one I had. Let's see what Ann says. I think everyone these days has anxiety, either to a greater or lesser degree. No, you're not crazy. Thank you, Ann. Um, and we do. We live in such a fast-paced society, and you're doing more. women are working outside of the home and then they're coming home and doing work. It's hard to juggle everything. Okay, general anxiety disorder. The symptoms of general anxiety disorder can be categorized into two primary classes: emotional, and people with generalized anxiety disorder frequently experience constant worrying or obsession about small or large concerns. These can include frequent nightmares, obsessions about danger, irritability, and restlessness. Now, my dad told me that when he first had panic attacks, he was worried about something, there are four of us, that something was going to happen to one of his children. And finally, Annette says this is her. Finally, a doctor convinced him, which they haven't convinced me yet, only worry about what you can change, and if you can't change it, don't worry about it. Oh, Catherine says, pardon my tardiness. It is such a long commute from the living room to the office upstairs. That's good, Catherine. Not a problem. You haven't missed too much. We're talking about how crazy I am. Um, okay, let's go to the next slide. I think we talk about OCD in here. The physiological, Lana says, no, we're not talking about that. Some of the physiological symptoms include heart palpitations, fatigue, high blood pressure, sweating, pupillary dilation, and sweating. When I have a panic attack, I have to get outside or get out of a closed room. Lisa says shortness of breath, and you do feel like you can't breathe, but when somebody asks me to describe it, I've never felt that way before, so it's hard for me to put in words. You almost feel like you're dying. I was just checking the chat here. Okay. I've got to read this one. Anne says, I think some of these symptoms are related to transcribed dictations. Lisa says, feels like my chest won't expand enough to get a breath. And that's a good explanation, Lisa. Ashley agrees. And Ashley says, LOL. Lana says, ha ha. And Cheryl agrees with Anne. Well, I don't know if you all were an Elvis Presley fan, but you remember when he shot the television. I've been a transcriptionist for 18 years, and I've actually thought about shooting the computer or the doctor. Oh, wait a minute. Here's a good comment. My mouse don't want to seem to work. Giselle says, I feel that way when I'm in a crowded place. I do too, Giselle. I don't like to be around a whole lot of people, like a concert or something like that. I can't get my mouse to cooperate. Jennifer says the oncology chapter is a setup for anxiety, depression, and panic attacks. Well, we should have had this way before oncology. I've heard that's pretty rough. Linda says LOL, and Catherine says, Jennifer, yes it is. Okay. Let me hide the chat again. Good chats. Oh, wait a minute. Somebody else said something. Sandra says she had one and I thought it was a heart attack. My husband took me to the hospital and it was closed. They sent me to Edmonton and found nothing. My doctor asked me if it was a panic attack. I said I have never had one before and have never had one since. That's good. She says scary. Annette says, yay, something to look forward to. Bernie says, good morning, looking forward to attend my first time attending a webinar. Bernadette, well, welcome, Bernie. You've been missing a lot of good stuff. Jennifer says, the surgical chapter is better. Lisa says, welcome to Bernie. Lana says, please forgive me, but I want to share that for me anyway, I had quite a few panic attacks in the past. I lost all muscle tone, would collapse on the floor, could not speak as the chest was so heavy and short of breath. The only way I was able to overcome it was to truly give it all to God and trust Him fully. It is a long story why I had them, but when I learned to pray more and worry less, I have not had one since. That's fantastic. Jennifer says, welcome, Bernie. Annette says, thanks, Jennifer. Yes, and I can't tell you the last one I had. It's been years, and I'm glad that works for you, Lana. I had a preacher tell me one time that if you were right with God, you wouldn't have depression, which I totally don't believe that. Depression, people don't understand depression is a disease like heart disease or lung disease, and that's why it's such a stigma on it. They don't understand it if they've never been depressed. Jennifer says, that is not true, Robin. I'm a Christian, but that preacher was wrong. I agree, Jennifer. Totally. And when he had a kidney stone, he was looking for pain pills, so I could have said, you know, if you're right with God, you're not going to have pain with your kidney stone. Linda says, isn't it a chemical imbalance? It is, Linda, and a lot of times, Lana says, yes, it's hereditary. My dad has it. I have 3 brothers. I've seen it in some of them, not to the extent that I have it and my dad has it, but the older my dad gets, the better his gets. Lisa says, it is, but it's a frame of mind as well. If you choose to take a positive attitude, you can overcome anything. Ashley says, sometimes it's not that easy, but I agree. Lisa says she has it as well and managing without meds. That's wonderful, Lisa, if you can do that. Sandra says, I think keeping active is good for it. It is. Now, I have a bad habit. If I get depressed, I tend to want to lay in the bed and forget everything. But the more you do and stay active, you have to fight it. Lana says, I agree, Lisa. It's very difficult at times, but it does not happen overnight. Lifestyle is very important. Linda says she eats chocolate. I do too, Linda, when I'm stressed. That's my go-to food. Okay, good questions and good interaction. I'm glad you're not afraid to share, because this is just between us. We record it, but I don't think anybody ever listens to it. Lana says, worst food for that, ladies. Sandra says, sometimes it is hard to get motivated, but it does help and make you feel better. And you're right, Sandra. I go to water aerobics sometime at 5 in the morning, which it kills me to get up at 5. But after I get up and go, I feel so much better to start the day off, on a positive note. You've got energy and you feel good because you've exercised. Okay. Let's hide this again. The causes, I forgot what we were even on. Oh, general anxiety disorder. The causes, as with many other mental conditions, anxiety is usually caused by a combination of genetics and environmental stressors. It usually involves the release of three key brain chemicals: serotonin, norepinephrine, and dopamine. And I'm sure you've probably heard of this, those of you that have got to the psychiatry chapter. And I had a student say, well, why don't you do it on psychiatry? Because we don't have a psychology chapter, but it kind of all relates. Okay, here we go. Panic disorder is a condition characterized by recurrent episodes of panic attacks. And this is the way I got this information off of the internet, and this is how they describe it. A panic attack is a sudden, and they made a typo, episode of extreme fear and apprehension. It is usually brief in duration, typically not lasting more than 30 minutes. Now, I've had my dad say he would be driving down the road and have to pull over and get out of the car. For some reason, enclosure, I think, does something to you. Okay, panic attacks can be extremely frightening and often appear for no apparent reason. When panic attacks occur, they trigger several emotional and physical reactions. During a typical episode, you might think you're losing your mind or dying. You might have experienced one or two panic attacks in your life, but if the panic attacks are more frequent and you are in constant fear of another one, you may have panic disorder. Okay, I see some comments. Okay, Annette says, I remember grocery shopping and dropping everything and running out of the store. I remember one time at church, Annette, I was carrying a pitcher of water and dropped it, and for some reason I had a panic attack. I guess because I dropped it in front of everybody and was ashamed of it, but I had a panic attack. It's a scary feeling the first time you have one. Okay, symptoms of panic disorder. Lana says every time. You're right, Lana. Heart palpitations, pounding heart, rapid heart rate, excessive sweating or having chills, trembling or shaking, smothering or feelings of choking, shortness of breath, I think Lisa mentioned that, chest pains, and cramps or constipation. Oh, I was just checking my chat box. Whoops, I put that in there twice. Let's skip that. Some more symptoms are feeling dazed, faint, or lightheaded, depersonalization, being detached from oneself, fear that you're losing your mind, fear of death, paresthesias, tingling or numbness in the hands and fingers. The causes: environmental factors such as an overly cautious view of the world expressed by parents and cumulative stress over time have been found to be correlated with panic attacks. Panic disorder is also known to run in families, so heredity also plays a strong factor in who might get it. So I agree with that because my dad has it. Lisa says, LOL, what about power bowel evacuation? Always get that right before a test. It's how you know the panic is coming on. LOL. I expect all of you have experienced panic going through the course. That's just a given. Whether it's a test, a dictation, a pie, or whatever. Linda says still. Okay, the medications. The U.S. Food and Drug Administration, or the FDA, has approved several medications for anxiety and panic disorder. These include benzodiazepines. These medications, like alprazolam or Xanax, and diazepam, Valium, can help relax and sleep better. Individuals who take these medications sometimes experience memory problems or dependency. Now, I don't know about Canada, but I don't think Valium is prescribed like it was in the States because people got addicted to it so bad, which they do get addicted to Xanax too. But the only time I've ever taken Valium, I had had a miscarriage and the doctor gave me Valium. Okay, Sandra said it keeps your heart going, and Giselle said yes with a bunch of S's on it. Oh, Catherine says, we have one doc in our small town who refuses to prescribe benzos. That's interesting. I guess because they are so addicting. Lisa says they use it a lot in the residentials for elderly. The antidepressants, these can include fluoxetine or Prozac, sertraline or Zoloft, citalopram or Celexa. Antidepressants can be useful in reducing the symptoms of co-occurring conditions such as anxiety or depression. Lisa says, seem like it's easier to drug them than deal with the problem sometimes. Yes, and that's a good point, Lisa, and I really have a problem with that. The doctors want to give elderly people medication to keep them sedated, and that really ticks me off. That's a sore item with me. They're just as, some older people are just as vibrant as other people, and I don't think they should be treated that way. Annette says, me too, and Ann says, I hate that too. Okay, Lana says, tip to avoid anxiety. Pattern interrupt, which means interrupt any negative or wrong thoughts with positive, happy thoughts. A song, a scripture, repeating truths about yourself and not the negative lies that you really are not, but you have been told or told yourself. Lana agrees. Catherine says we have lots of that. Ray, her spouse, was on morphine for 5 years for arthritis severe. When he asked to come off of it, he had worse pain that turned out to be cancer. Catherine says it was a highly curable cancer, but left so long it is now metastatic. Giselle says that is true, Lana. And Eileen says, how about the side effects of these drugs? There are many people that are prescribed further medications to suppress the side effects. Bernie says, I agree with that too. Spending time with them, I found using visualization or relaxation exercises helpful for myself in the past, very useful, and now we'll refer back to that and it helps. Now, Bernie, I think you're the student that told me to play some relaxing music. I can't remember if it was Zen or what, but during the Christmas holidays, I play Christmas music in my background on my computer to get me in the holiday spirit. I'm going to Hawaii in March, so I've been playing Hawaiian music to get in the mood. So I'm trying that to see if that will lift my spirits, and it has helped. I never would have thought to do that. Catherine says Dan Gibson's Solitudes is very therapeutic when studying. Okay, thank you. Sandra says music is good for the soul. Bernie says glad to hear that. Yes, I've given it a try. I have to turn it down sometime. Um, Linda wants to know what part of Hawaii I'm going to. The Big Island, Maui, Honolulu, one that starts with a K. Let's see, and it's maybe one more. That's my dream. Oh, that's it. Caui, Linda. My husband promised me when he retired he would take me. I may just stay over there. Lisa says birth of a 3-year at 40 sort of snaps you out of depression too. Not recommending it for everyone. Hee hee. Oh Lord have mercy. Yeah, and Bernie spelt the K word. Nola says, Robin, you should try and do the road to Hana on Maui. It is beautiful and worth it. There's several options, Nola, that we're going to do, like a dinner cruise to Diamond Head, and there may be a helicopter ride, and I don't know if that's the road you're talking about, but it has lots of waterfalls and bridges. So we're going to do the optional stuff. Lisa had a newborn 3 years ago, and my hat is off to you, Lisa, if you're taking the course with a 3-year-old. Ashley says the road to Hana on Maui is amazing. I second that. Well, I better get back on track. Oh, Ashley is taking the course with a 9-month-old. Very difficult, I'm totally sure. Okay. Make it a second honeymoon and it will be good for anxiety. Well, it kind of will be because we've only been married 3 years, so I think we can work that in, Sandra. Lisa says daycare for your 9-month-old or her 3-year-old. Okay, another thing I wanted to mention about Prozac, obsessive compulsive disorder. Oh, Lisa says not no for your peace of mind. I used to have OCD, just a mild case of it. Like I would check the stove and I hadn't cooked. I'd check the iron and I hadn't ironed. I'd check the door lock. And they gave me Prozac for that, which, years ago, Prozac was like a killer drug. I think some people had been on Prozac and killed people or something, but it really worked for me. Okay, let's go to the next slide. Here we go, obsessive compulsive disorder. It's a psychiatric anxiety condition that affects 1 out of 50 Americans each year, according to a study by Gary Null and the author of Obsessive Compulsive Disorder. And I think I saw a comment. Some people have it really bad. Ashley says she has very bad OCD. And I don't know how to pronounce this word, trichotillomania. Ashley says she hates it. Lana says a lot of nurses get OCD. Well, that's interesting. I didn't know that. It's terrible. I know, I have a cousin, maybe second cousin, that washes his hands constantly till they're about raw. Let's see. Robin says, Prozac only works for so long. My husband has been on it for years. Oh, okay. I haven't been on it in years and years because my OCD kind of cleared up, thank goodness. Lisa says, makes sense, Lana. Routine is important. Whoops, I missed it. With nursing for your safety and your patients. Okay, let's move on. OCD. It's characterized by repetitive behaviors, anxiety and difficulty coping with intruding thoughts, obsessions, and ritual behaviors, compulsions. And it's a really bad disease. And we were talking about medications a while ago given to elderly people. There's a lot of herbal medications that doctors don't approve of, and I have taken some and they have interfered with my regular medications. So if you take any herbs, you should verify that with your doctor to make sure it doesn't have a contraindication to your medication. Okay, Jennifer says we need to remember too that what works for one does not always work for the next. And some people need medications and our love and support and not our condemnation. I tend to lean more to be natural, but I have at times needed medications and I thank God for that. That's true. It's not going to be one answer for every person. I've read about yoga and meditation. They say that is relaxing. I've never tried it, but they say that's good for anxiety. Okay. I can get my mouse to work. So what causes OCD? It's really not known what causes it, the nature of it, or why it happens. Lana says, true, Jen. Recent studies indicate abnormalities with serotonin levels in the brain, and serotonin is a neurotransmitter that is thought to regulate anxiety, sleep, appetite, and sex. Recent research suggests that OCD sufferers might have abnormally low levels of serotonin since they seem to benefit from serotonin reuptake inhibitors, or SSRIs, antidepressants such as Prozac or Celexa. Let me see if I see a comment. Oh, that was Lana. Okay. Okay, post-traumatic stress disorder or PTSD. It's an anxiety disorder that can develop after an exposure to a severe traumatic event. Some traumatic events include rape, military combat, abuse, or accidents. And this is really serious. I haven't read that much about it, but I've seen some TV shows talking about PTSD, and it can just make you, what's the word I'm looking for, not able to function if it's severe enough, which I can't imagine rape or military combat. This condition may also involve the fear of death or harm, where the individual is overwhelmed and unable to cope normally. Let's see, somebody's made a comment. Catherine says, I still have flashbacks from a bank robbery. Oh, Lord, I would too. Lana says, oh, man. Oh, Catherine says she had the gun put against her forehead. Lana says, you didn't rob it, did you? Ha ha. And then she says, oh, no, I am so sorry. Jennifer says, oh, dear Catherine. I think that would be hard to get over. Catherine says, being young, the only description was that they were all young with good bodies. Catherine says, she didn't rob it, ha ha, she was the teller. I would give them anything they wanted if they had the gun to my head. Okay. A person with PT. Oh, Eileen says that happened to my sister. She was also a teller. And my chat went away. Let's get it back. And then had to face the robber in court. Yeah, that would give you nightmares for sure to keep seeing his face over and over. Well, here it talks about that, Catherine. A person with PTSD can re-experience the original trauma months or years after it occurred through flashbacks or nightmares, as well as experience increased arousal such as insomnia, anger, or extreme paranoia. And paranoia would be bad. I mean, you would think about it. Did you still continue to work at the bank? Because you would constantly be thinking about, is that going to happen again? Oh, you did for a while. Okay. Ashley said she would demand a raise, LOL. Um, PTSD can develop at any age, including childhood. However, this condition is more common in women. This can be due to the fact that females are more likely to become victims of physical violence, harm, and rape than men. And I've seen a comment. Catherine says, then went back to school, but I still can't work on the front line of anything. Lisa says, because men are generally the aggressors, question mark. I worked at a grocery store in high school, and I had to make bank deposits, which we were escorted by a policeman. And it just so happened the night I didn't go, the store manager went, and he was actually shot. So from then on, the store manager went instead of a cashier. Okay. Okay. Oh, Jennifer says, I think Lisa is referring to the PowerPoint detail about women having PTSD. Oh, you're probably right, Jennifer. That went right over my head. Okay, the symptoms of PTSD can be categorized into three primary classes. Reliving. People with PTSD frequently re-experience the terrifying event through intrusive thoughts and recollections of the trauma. These can include frequent nightmares, out-of-the-blue flashbacks, and in some cases hallucinations. Annette says, I think plenty of men are victims as well. They just don't come forward like women do. And that's probably true, Annette. Okay, avoiding. Let me hide this. The person will gradually distance from others, places, or any circumstances that can bring back the memory of the trauma. Eventually, this can result in depression in family and friends. Increased arousal. This class is characterized by extreme emotions such as difficulties relating to other people, inability to express closeness like before, insomnia, frequent anger outbursts, moments of rage, difficulty concentrating, and restlessness. Okay, attention deficit hyperactivity disorder. I've got a comment here. Lana says, I had PTSD as I did experience one of the said triggers, but everyone who has it be encouraged. We can overcome this as well. Remember, it is not still happening and you are in control and will not allow your life to be stolen anymore. Pattern interrupt. Stay positive. No more flashbacks for me. Praise the Lord. That's great. Okay. Um, Attention deficit hyperactivity disorder. Lisa says sometimes it just takes forever. Like for me, I still deal with my abuser on a weekly basis because he sees our daughter. Yeah, and that's a bad situation to be in for sure. Okay, ADHD. ADHD is the most frequently diagnosed behavioral disorder of childhood and affects 3 to 5% of school-age children worldwide. I was checking to see if I had any comments, but I don't yet. Okay, ADHD is a chronic condition characterized by inattention and hyperactiveness that lasts well into adulthood. Adults with ADHD often have difficulties maintaining long-term relationships, perform poorly in school or work, and tend to have low self-esteem. And there's a big controversy on medicating children with ADHD. I know that when I was typing for the doctor's office, they would stop, like they would have the child on Ritalin or Strattera or whatever during the school year, but give them a break during the summer so they weren't on it constantly. Because I don't know, it's just a big controversy over it because, do you want your child medicated to behave or what? Okay, I'm going to have to hide this to get everything. In most people, symptoms of ADHD start before the age of 7. A diagnosis of ADHD can be difficult for parents and children. However, treatment can help, and the majority of children with ADHD grow up to be successful adults. Okay, the symptoms of ADHD can be divided in 3 subcategories: inattention, hyperactivity, and impulsivity. Inattention frequently makes careless errors in the classroom, work, or other activities. Difficulty listening when spoken directly. Experiences problems with completing chores, schoolwork, or duties. Regularly has difficulty with organization and planning. Often forgets important items necessary for work or school, for example, a notebook or pencil. Becomes easily sidetracked by external distractions. The hyperactivity, it's regular fidgeting with hands or feet, talking excessively, difficulty engaging in regular activities appropriately, and constantly feeling the urge to move or be on the go. Impulsivity frequently answers questions before they have been completed, difficulty awaiting turn, and often interrupts conversations. So what causes ADHD? There's not a lot that's known about it. Researchers have identified important factors that could play a role. Changes in the brain. Recent studies have revealed less activity in the areas of the brain that control activity and attention than in normal children. Heredity. Attention deficit disorder can run in families, and I did not know that. Studies have shown that about one child with ADHD out of 3 has a relative with the same condition. Exposure to drugs. Women that are pregnant who smoke are at a higher risk of having a child with ADHD. Similarly, women who abuse recreational drugs or prescribed medications are also more likely to have children with this condition. Scientists have hypothesized that alcohol and drugs impair brain activity by restricting blood flow to the nerve cells that produce neurotransmitters such as dopamine or serotonin. Exposure to environmental toxins. Children that live in older buildings are at risk of chronic lead exposure. That can result in highly disruptive behaviors and attention problems. The new medications are stimulants and non-stimulants. Stimulants include Adderall, Dexedrine, Concerta, and Ritalin. They are available in fast release, about 4 hours, and long release acting, 6 to 12 hours. Parents prefer the slow release option for their children because of its longer lasting effects. However, it may take up to 3 hours to kick in. The stimulants help manage impulsive behavior and strengthen attention span by increasing the release of neurotransmitters such as epinephrine and norepinephrine that transmit signals between nerve cells. Even so, the effects of these medications fade away rapidly. Furthermore, the proper dosage differs from person to person and from child to child. Therefore, it will take a little extra time at first to get the right dosage. The side effects can include nervousness, irritability as the medication wears off, problems sleeping, weight loss. Some children develop tics or unusual gestures, for example, an exaggerated grimace, but these tend to go away when the dosage is reduced. Okay, the non-stimulants. The brand name is Strattera, and it's the most popular non-stimulant to treat ADHD. It's usually used when stimulant medications are no longer effective or cause side effects. Aside from reducing ADHD symptoms, oh Lord, I don't know how to pronounce that, atomoxetine has shown to also reduce anxiety. The common side effects can include nausea, sedation, weight loss. Atomoxetine has also been linked to liver problems in some children. Call your doctor immediately if you notice yellowing of the skin, jaundice, or dark-colored urine. Okay, autism. There's a lot of talk about autism, especially in the States. The Center for Disease Control estimates that 1 in 110 children in the U.S. have a form of autism spectrum disorder. Autism is a neurodevelopmental disorder characterized by impairments in communication, repetitive behavior, and social interaction. Symptoms generally start at the age of 6 months and become established by age 3. From there on, they continue uninterrupted through adulthood. I think we're almost out of time. If you are a parent and you suspect your child has autism or happen to know a family with someone with autism, you are probably wondering what you can do. You might feel angry, confused, or helpless. After all, you probably heard that autism is an incurable condition and you are hoping that your child's behavior is just a temporary phase. Whether your child has autism or not, you can make a difference by knowing the early warning signs. Treatment is usually far more effective when the condition is caught early, ideally by the age of 1.5 years, so watching for early symptoms is crucial. Appropriate medical care and knowledge can minimize the symptoms of autism and help your child grow and learn more like a normal child. It's showing the warning signs at 6 months, lack of warm expressions or smiles, 9 months, absence of sound imitation, no motivation to share smiles or basic emotional expression or cries, 12 months, does not respond to name, absence of babbling, no playful gestures. By 16 months, does not speak or learn words like mom or dad. 24 months, does not speak beyond meaningful two-worded phrases, continuously imitates or repeats the same words. There's no cure for autism. The symptoms become less severe with age. Generally, children with IQs above 50 have a better prognosis for full independence than those with severe autism. Over time, with consistent treatment and social skills training, some individuals make significant progress in communication skills and are able to establish meaningful social relationships. Okay, I timed that about perfect because we've got 5 minutes. Any comments or questions about anything? I hope you learned something. I hope it was interesting. Thank you, Catherine. Catherine says fabulous information. You're welcome, Nola. Linda says very interesting. You're welcome, Tracy. Catherine says very interesting. And Anne. I'm glad you all enjoyed it. Okay, off to school. Get those little fingers moving. Ashley says it strikes me as odd that a child with a hyperactivity disorder would be given a stimulant. Although I don't agree with it, you'd think they'd be given a depressant type drug. I would think so too, because the stimulant is going to rev them up more than calm them down. Bye. You all have a good rest of the week. Happy typing. Jennifer says thanks to everyone for sharing difficult things. It's good to share sometime. Lana says time to dance on the keyboard. Me too, in a different way. See y'all the next time.